Hey Abby,
Hi, how are
I'm
you?
I'm well. How are you?
Good. I'm so excited
Good.
for our conversation.
I know, me too. I'm so excited to talk to you today about what moms should know before they start the feeding journey, kind of a little bit of like the theoretical framework of starting a feeding journey and practical framework of starting a feeding journey. So let's just start off.
Jump right in. Well, first of all, I love that you just say feeding journey because
Yeah.
I feel like as a pregnant person or, yeah, just for the first time preparing to go into this, you just really don't know what's going to happen. You might know a little bit about formula feeding or bottle feeding or breastfeeding, but you're like, I don't even know how my birth's going to go yet, let alone how I'm going to feed the baby. And you hear different things from your friends and family members. And I don't know, you may have different examples around you. So I like just starting with, okay, the feeding journey, however that unfolds.
Yes, yes, like the neutrality around it because it is so emotionally charged. Like,
It is.
yeah, as an IBCLC, why do you think that is?
I think it's because I've thought a lot about this, and I think people fall somewhere on the spectrum of like what they know, like I was saying, but also just what they feel about it. Like if they feel super passionate about making breastfeeding work no matter what, or if they're like, hey, I just want to see what happens and um, you know, just they're more maybe experienced or knowledgeable that things can come up that make it not so easy.
Mm.
And I mean, what we do know is that like 80% of women initiate breastfeeding and say they want to breastfeed. But then by 6 months, only like 30% of women are actually still breastfeeding, which is a huge jump.
Yeah, yeah,
And so yeah,
that's really interesting. Go
it
ahead.
is. It is. It's interesting. So it's like to me that just says that we know that women aren't getting enough support um to meet their feeding goals. We do know
Mm.
that. And that support looks a lot of different ways. We used to have like this built-in village, used to meaning like hundreds of years ago. Obviously culturally now, like some people don't even realize the benefits of breastfeeding. Like even my IBCLC friend was telling me that how she got into breastfeeding was because she had her first baby. She started formula feeding because breastfeeding maybe wasn't coming as easily. She didn't
Oh,
have the support or no. And then she starts formula feeding. And then she realized somewhere along the way that breastfeeding actually was, nutritionally great for the baby, great for bonding, great for the oral facial development. A lot of people don't know about that. And so, and good for like learning satiety, like fullness cues, basically.
yeah.
And so there's just so many benefits. It actually reduces your cancer risk as a mom breastfeeding, like
Wow.
so many things. And she didn't know about any of this. And so then with her subsequent babies, she was like, I'm definitely going to breastfeed. And she wanted to become a lactation consultant because she was like, well, I didn't even know that it was even something to try hard for.
Yeah.
Because the reality is, a lot of women do have to try hard to make it work because we just
Mm.
don't have the village and the support. So you kind of have to seek that out.
Yes. Yeah. Wow.
Yeah.
So much of what you just said, I want to get into and I want to piece apart. But specifically, these obstacles to breastfeeding that the majority of women either start their journey with breastfeeding and then for obstacles come up for lots of reasons, not their
Hmm.
own
Hmm.
fault, and then it drops off. And also the lack of education that you
Yes.
touched on is specifically in women that people don't know. Even your friend who became an IBCLC,
Yeah.
that she didn't know. She didn't know until
Yeah.
she had her second child all of the benefits. So I'm wondering if you can talk more about the benefits. You talked about oral motor, you talked about nutrition, you talked about relationships. So whichever one of those you want to focus on first. And once a mom's bought in, say we're talking to moms that like, okay, I'm fully bought in, then what you should know before having your
Hmm.
baby.
Great question. And I think
The long one.
this is a great thing that you can learn, by doing your own research, but also by doing a prenatal consult with a lactation
Interesting.
consultant. Because if you do it during your pregnancy, let's say after like 30 weeks or something, you can build a relationship and gain knowledge before you are postpartum and having all these hormonal rushes and changes, and
Yeah.
you're sleep deprived, and you have this new baby, and you're trying to feed the baby. So
Right.
I hope that this conversation can be helpful for people to watch and learn before they have a baby, but also just meet someone, find a lactation consultant in your area so that you can build a relationship and already kind of trust someone before. Um, so that's just a little plug there. But
Yeah.
I do think um, what people need to know is just kind of become an expert a little bit on your body and on what needs to happen to bring in your milk, because um and you also asked about the benefits. So
Yeah, it was
yeah,
a long
first we
question,
need
so
first we need to buy in, is like you said, we need to know why we care. Like,
yeah.
why do we even want to do this if it is going to be hard or
Right.
a challenge? And hopefully maybe it's not, right? But I just, in my experience, something always comes up. So it's like, why do we want to care about this? And if no one has breastfed around you, maybe you don't know why we care about this. One reason I think is just your milk is going to come in anyway, right? It's going to start coming in. So we have to, it makes sense. And I think 80% of women, obviously, like, and I should double check that it's 80, but I know that it's between 80 and 90%, like, try. So we know that women try. And whether it's like, you just feel like when you have your baby, it's just a natural thing to put them on your breast um and see how it works out. But I mean, just the nutritional reason, like, human milk is human milk for a reason. It has tons of probiotic factors that like line the gut. So the what you eat in those early days, especially the colostrum, and really as long as you're exclusive breastfeeding for, is setting up their gut for their whole life. So people
Wow.
have, yeah, so babies who are breastfed, like we know, have good immune benefits, gut microbiome benefits. Um, they just they so we know that it's a healthy food for babies. It's easier to break down. Sometimes the babies, unless they have an allergy or sensitivity or something, like, it is maybe less gassy for them, like easier
Yeah.
for them to have bowel movements and like process, because it's human milk. Now, it's amazing that we have formula that can substitute for that. Like, in the olden days, we had to use other things like goat's milk or like different
Right.
things that didn't maybe have all the nutrients and vitamins that we need. So it's good that formula does have that. But formulas are usually either cow milk protein based or like soy based. There's different bases for them, and it's just not human milk. So nothing's going to have all the same exact ratios and everything that human milk does. And then oral facial wise, that's something that I kind of specialize in as a speech pathologist, that I don't think a lot of people understand is that, and we could do a whole podcast on this, but like,
Right.
breastfeeding, the act of latching with your lips nice and big and your tongue cupping and doing that sucking at the
Yeah.
breast, actually develops your orofacial and jaw structures and helps your tongue develop to be the architect of the face. So your tongue, everyone's tongue, is supposed to rest on the roof of the mouth,
Okay.
and it is supposed to help widen out your palate. And the act of breastfeeding is also supposed to widen out your palate, which then widens out your smile as you grow. So in the first 5 years, your palate widens out. And really, based on how long you breastfeed for, what hard resistant foods you eat when you start solids, like working this jaw is what helps you have space for all of your adult teeth. And
What? Okay.
yeah,
So just to interrupt you really quick, because I'm
yes,
loving
please.
this. But so, as compared to bottle feeding, you might
Yeah,
say, like, breastfeeding helps that oral
your jaw.
facial development.
Yes. And
Wow.
other things, bottles and pacifiers can be worse just because they're like
Uh,
they're um kind of encouraging this more arched palate
Interesting.
as opposed to the tongue. Um, so we really want like closed tongue, mouth closed posture when babies are sleeping. We really want, yeah, just the active breastfeeding and using that tongue properly. Now, if you need to use bottles, most people in this day and age are going to use bottles sometime and are going to
Sure.
use pacifiers, right? We can use certain bottle shapes and pacifier shapes that are better for that palate development. And we can wean bottles and pacifiers earlier. So, like starting around 6 months, well, 6 to 9 months, I would say you start decreasing the pacifier usage. And then by a year, totally gone. And same thing with bottles, you might keep using bottles if you are doing formula or exclusive pumping. You would keep using the bottles while you're introducing solid foods, but by a year get them onto like a straw cup or an open cup, so that
Super
you,
interesting.
as the teeth start coming in, their tongue is functioning the right way and resting on the roof of the
Wow.
mouth. Mhm.
So, okay, we've talked about nutrition, we talked about gut and
Oral
with
facial.
that gut, and we talked about
Mhm.
oral facial. Just to note, like that's really interesting
Mhm.
about the gut because
Yes.
the all of the kind of craze around gut microbiome right now, but you could give your child a good microbiome from the start, and then they can, kind of move off
Yes.
that as they choose their own foods. But from the beginning with breastfeeding, that's really
Yes. And
interesting.
that's something that I like, I'm not a nutritionist or a specialist in this, but there's people that
Sure.
can tell you even more about like the nutritional benefits
Wow.
um of it. And also it also exposes your baby to allergens because your breast milk is made from your bloodstream, but it is affected by the things that you eat. So it's not like you eat and then it goes through your stomach or anything to them. It's
Right.
just that what you eat affects your bloodstream and then affects the milk you produce.
So
So
interesting.
that's why, like, for example, if your baby's sensitive to dairy, you will notice that after you eat a piece of cheese or something, they might be fussy or they might have something in their stool or whatever. But it's also the case that if you eat foods that are like really high in certain vitamins and things, that will get passed down to your baby too. And then the allergens exposure, like babies with breast who are breastfed or who are given breast milk, I should say,
Yeah.
have better like not as many allergies. Another thing is that we didn't even get into like the attachment and the bonding. One
That's
thing we
okay.
want to talk one thing we want to talk about today is how you can have an attachment feeding relationship even if you are bottle feeding, because I mean, as a ex NICU mom, like I know sometimes you have to bottle feed and you need to, I don't know, I think it's empowering to know how you can still have this bonding relationship
Yes.
even if breastfeeding isn't going as well.
Yeah.
But um but I do think it's cool to know that like part of what's so cool about breastfeeding is that it's this reciprocal relationship where the baby cries, you latch them, and that encourages your milk supply, that tells your body to make more milk. And
Yeah.
so you just naturally have this responsiveness that's built in,
Mm,
which really makes sense evolutionarily speaking, because
yeah.
babies are dependent on us for their survival. Like, I think it's like human babies are born like really prematurely even if they make it to 40 weeks compared to other mammals, because they're so dependent. Like they really can't do anything by themselves. All they can do is cry to tell us what they need. Like they
Yeah.
can't walk, they can't eat. Like you see like different mammals giving birth and they are already walking or something. And
Yeah.
it's like we really till 9 months we can't even begin like moving around fully
Yes.
by ourselves. So that's why we're called like carry mammals, and we're supposed to have this baby and feed the baby. And so I think, you know, that if breastfeeding is going well, it just sets you up to be very responsive and attached to your baby. Um and so we want to try to replicate that with bottle feeding if necessary.
It, and I think that it's really cool to just give an ideal to the general public. You know what I
Yes.
mean? Like, if we are speaking to women like me
Yeah.
who haven't had children yet and don't know anything about
Yes.
breastfeeding. I mean, before I met you, I didn't know anything about breastfeeding.
Yeah.
And to give an ideal of like, this is the best way to educate yourself prior to having a child. And this is
Yes.
how to set yourself up for success so that you can receive these benefits.
Uh-huh.
Or for mothers who, like your friend, didn't breastfeed their first child because they didn't know and you don't
Yeah.
know what you don't know. And then they're like, oh, dang, that's awesome.
Maybe
Let me
I'll
go
try it
ahead
again.
and exactly do my best. So, and so going
And then
back to
take the
this,
shame out of it because like you said, it is a hot button topic. It does get heated and controversial. And it's like, at the end of the day, fed is best. Like we have to feed these
right.
babies, but like, how do we show an ideal so that people just, I don't know, have something to go off of, like you said. Yeah.
And I'd love to talk about the benefits to the mom as well, to the mother, like the breastfeeding benefits of the mom. But I want to touch on this attachment piece of,
Mhm.
I forget what word you use, but like this attunement between the mother and the baby and how
Mhm.
breastfeeding and feeding in general can kind of create that attunement, reciprocal relationship between
Yeah, responsiveness. Yes.
responsiveness. Very good.
Yeah.
Um,
Yes. I think that so the first thing you should know is like after you have the baby, literally delivering the placenta sends your body into a different state and totally different hormone drop. Like and it's you feel it, it's called the baby blues. That's why people are so emotional because it's such a huge change for your body hormonally, but that also tells your body, okay, it's time to make milk. And so you need two things to make milk. Number one, you need to um deliver the placenta. So that's why like retained placenta can be like a risk factor for low milk production, for example. But you have to get the whole placenta out and then you have to latch the baby. And your body needs a really, really strong message in the first 2 to 5 days to make the milk. And so that strong message means like on demand feeding. So that would be like 8 to 12 times a day, like really just whenever the baby is alert enough because they're so sleepy in the beginning. So whenever they're alert enough and able to latch, we should be latching them. So I
Interesting.
think this is the piece that like I really want everyone to know because if 80% of women are trying to breastfeed but then something's happening that they're not getting their milk in, and people, we talked about this before, is that like you know people will say like I'm waiting for my milk to come in for 5 days.
Right.
It's like
Right.
yes, it can take 5 days for your full milk supply to come in, but we are an active participant in that,
Like the other
and
month.
latching the baby is what makes the milk come in. It's not going to
Interesting.
magically come in. and
Oh,
so
interesting.
and so that's why we have to be latching the baby. And if it's not an effective latch for whatever reason, another hot button topic is tongue ties and latching issues have
Gotcha.
been because now that women are trying to breastfeed more and they might know the benefits, right? And they want to breastfeed, but then they're having problems. And then
Mhm.
you need to know what to do. So, because those first 5 days are so important, if the baby is not effectively transferring milk, then you need to get out a pump. And a pump is going to help you just be a tool in the meantime to get the milk out. And tell your body, hey, let's put in the order for milk. There's a baby here.
Yeah.
Yes,
That's
but I might have gotten a little sidetracked. You
that's
said just the attachment relationship and tell me more what I missed about
yes, yes. Well, hence,
the
just to touch on
benefits
that,
too.
hence the need for a prenatal
Console. Yes.
lactation consult because you don't want to have your first couple days and have feeding issues and then be like, oh, now I need to find a
And
lactation
miss that
consultant.
window. Yeah,
Yeah,
and then miss that window too where you're like,
yeah,
"Oh, no," or maybe you know that you should be pumping, but you don't know how often, how to do
yeah,
it. Like, hopefully
yeah,
in a prenatal consult, we would go through your pump with you, which can be covered by insurance for most insurances will cover a free pump. Um,
yeah,
and so you wanna order that before, figure out how to use it, kind of prepare that, like, breastfeeding will include pumping at some point.
yes.
Hopefully, maybe it won't right away, but prepare.
Love it. And then the
Mhm.
two things I think that will probably like wrap us up
Mhm.
is yeah, the benefits to the mom and this idea of an attachment relationship. And the thing that I found most interesting as someone who doesn't have children and but wants to have them is like this idea of the baby's brain is is developing within the
Yes.
womb and then outside of the womb, and that's their first environment. So like what is their first environment outside the womb is laying down those neural networks. And that's
Yes.
what fascinated me about breastfeeding because, right, whatever environment they're coming into matters for their exposure to the world and then the
Yes.
attachment to the person who gives them life. And you learn about, we both went to SLP graduate school.
Cool.
You
Mhm.
learn about these child development and you learn about like the strange situation by Mary Ainsworth
Yes.
and that these
Attachment.
exactly, these children have different attachment styles and that actually birth and breastfeeding can affect that. So yeah, please share what
I
you
love okay, I
yeah.
first of all, I just love how you, like, zoom out and make it, like, this is why it matters because I feel like we can get so in the weeds about, like, formula feeding, bottle breastfeeding, like,
Yes.
supplementing, like, blah, 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 and it's like, okay, but why does all of this matter? It's because feeding is the first relationship that
Mm,
you have with your child. Like, they come out of the
what
womb
is
and they
it?
cry, and they are like, "Feed me," because 'cause they've been connected to a placenta this whole time that's been just feeding them, and this is their first time they have to express a need and then get that need met. And
Met.
that is all and that's what they learn. And if babies are
Um,
not this is sad, but like if the baby's needs are not met, then they're learning like, "Oh, the world is not a good place." You
yes.
know? And
Yeah.
so we need to teach them, we need to like show them with our actions because they don't communicate with words yet, right? They just cry, and we need to say, "Oh, we're here to soothe you and meet your needs," which basically their needs in the beginning are closeness because
Yeah.
they've been in your body the whole time, hearing your
Yes.
heartbeat, hearing your
Beautiful.
they've been feeling your movement. They're connected to you. And anyone who's been pregnant knows that and knows when you're give birth, you just and of course there's different reactions, but like you usually do feel very strongly that you want to respond to your baby's needs. Like that's like that
Mm,
anxiety you feel when you're like in
yes.
the shower and you feel like you hear the baby crying. And then I would like come outside and be like, was he screaming? And my husband's like, no, no, he
No.
was sleeping peacefully. He's fine. And
So
that
funny.
might be, some postpartum anxiety we can talk about
Oh,
another day. But
great.
but it's like it is a real thing that your body is kind of like predisposed to be like on alert to respond to your baby.
Yes.
Yeah.
Well,
So I think yeah.
that well, just that part about like it is the first communication. Like a
Yes.
cry is a communication,
Communication.
and you putting your baby to your breast is communication, saying
Mhm.
I'm here, and I'm
Mhm.
here to give you your needs, and I'm here to meet those needs. And
Yes.
when we're learning about like language development, that's how you foster language development is
Mhm.
by if they use a word or a part word, something like that,
Yes.
meet their
Any
needs and
gesture,
meet the intention.
any
Yes.
sound, like even just like pointing to something, you're going to
Yes.
respond to that need. And I think
Yes.
we all like when we're teaching our babies language, we communicate so verbally in the world
Yeah.
that we kind of are like used to that more. But
Right.
really early, like, yeah, it doesn't feel great to just be cried at for everything,
Yeah.
but that is their only way. And I also want to just say a plug of like, let's say latching is not going well and like, oh my gosh, like I know in my mom gut, like this baby needs milk. I need to give them a bottle or I need to pump or I need to get help in this way. Like
Yeah.
that's also you listening to your mom gut and that's also you being like,
Good.
I'm responding to your needs and helping you and helping us both
Yes.
to figure out how
Grow.
to figure out this feeding relationship because
Yeah.
and that takes a lot of courage to like
Oh,
if let's say you were like gung ho about breastfeeding and
right.
you're like, oh my gosh, I want to do this no matter what. And you have the baby and then something's coming up and it's not going well. And the doctor's telling you, a doctor that you trust, and you've tried everything and you've done all the steps that I would recommend.
Right.
But then there really is a reason to supplement.
Yeah.
Um, then you're going to meet your baby's needs that way
Yeah.
and you can still be cue based with the bottle feeding and
Yes.
um yeah, so we should
Yeah.
continue this conversation, but I think, yeah,
I
there's a lot of benefits to just the mom as far as like decreasing their postpartum depression and anxiety. Like we
Yes.
know that moms, breastfeeding produces a lot of oxytocin and
Yeah.
relaxes the mom and also makes them sleepy sometimes. So sometimes the mom and baby in a safe way will fall asleep together if, the environment is good and someone is watching, making sure that it's safe. But there are so many benefits mental health wise, then physically decreasing different risks of breast cancer and other cancers.
Wow.
um I think it's even every month that you were breastfeeding or pregnant decreases your risk of like ovarian and
Wow.
breast cancer. um
See.
but it's
It's
also just for the whole dyad. I think usually when you meet moms where feeding is going well,
yeah.
they are just the baby's growing well, the
Yeah.
mom's mental health is recovering, everything's going well. And when feeding is not going well, yes, we can take steps to make it the best it can, but it does affect both people because
Yeah.
it's just
It's
that's the
implement.
main thing you're doing in the beginning is feeding this baby.
Yes. Well, and I love your point. So many good points. Okay, I'm like, is this gonna get sidetracked? But I love it anyway.
Fine.
This idea, I don't know if you ever heard of it, is fetal microchimerism, in that there's an exchange of cells. I like this goes
I
I,
love this.
this gets me crazy in the best way.
You're nerd
So
level. I love it.
yeah, okay. When a mom is expecting a baby, there's like this exchange of cells in which the baby's cells are with the mom
Mhm.
forever, and then
I
the
have
mom
heard of
cells are
this.
with the baby forever. And it's just
Mhm.
absolutely amazing that there's this the bodies are like one at some point,
Wow.
in like a biological way. So just wanted to
Amazing.
toss that out there.
No,
I don't
that's
want to
so
get
cool.
sidetracked, but yeah, it's just
Yeah.
so cool. And
There's another cool fact like that that
yeah,
is a little different, but it's like it has to do with like and you can do this like if you are exclusive pumping or bottle feeding, you can also just like kiss your baby to get this. But you know how moms have like this urge to like kiss the baby or like,
yes.
and the babies are always like touching the mom's face, whatever. The it's actually like a natural thing that the babies and moms are trying to biologically like exchange germs because
Wow.
when your baby's sick, the saliva from them onto your breast will tell your body to make the correct like antibodies to fight their germs, and that's why a lot of breastfed babies get sick less. Like there's just so many things
Amazing.
that just it's supposed to be a natural process for a reason. It's just
Yeah.
that because of so many reasons, because our jaws and tongues are not maybe evolving in the right ways, or also because we don't have the village of support. We've
Yeah.
medicalized a lot of things like birth
Sure.
and postpartum. Because of all these reasons, because maybe our mom didn't breastfeed, it
Right.
is
You don't
a
know.
harder environment to because we have to go back to work. We didn't even talk about
Yeah.
that. Or because we have to,
Societal.
go in society and people think it's weird if your just boob is just out all the time. Like there's so many barriers, I think, to breastfeeding that mean that if you really don't understand the benefit or have the support to get through the challenges, then like
Yeah.
it makes sense why so many people don't meet their feeding goals.
Well, and I love that you touched on like the courage needed to respond to your baby in whatever way. And
Yes.
that might look like knowing all of this that you just shared with us and being like, okay, now I had this baby. This isn't going to plan. And I need to get a third party in, like IBCLC. Well, that's probably
Yeah.
recommended anyway,
Yeah.
or tongue tie or something like that, where it
Yes.
just it needs to happen. And that's a way of responding to your baby. You know what I
No,
mean? Because you're
another
accepting reality,
and
and being like,
yes, and
let's
this is talked about a lot too, but it's another factor I think is like knowing yourself. Like there is a
yeah,
piece, and you've asked me this question before, is like how do you know when like maybe mental health wise it would be the best decision for you
yeah,
to not breastfeed? And I think that's another thing is like, okay, so let's say you know that like I this is now becoming a detriment to me. because you can't pour from an empty cup and that whole thing. So
Yeah.
it's definitely like sometimes it is the best move just to
Yes.
either make a change, and you don't always have to like completely wean. You can always like scale it back and work with the lactation consultant to like do some sort of combo feeding. That takes a lot of courage too, to just like figure out what is going to be best for you and your baby and still be
Yeah.
responsive and still be creating the attachment relationship you want with however your feeding journey turns out.
Yes. It's amazing. Like, I love that we just touched on cue-based feeding
Hmm.
and this relationship aspect, but that would be awesome to talk about at another point. This
Hmm.
idea of what are my baby's cues? What do they look like? Besides just crying, when have they
Yeah.
had enough, even if I am bottle feeding.
Oh,
So,
there's so many
yeah,
cues that they tell us.
yes,
Well, that's something that we both are really passionate about because we've worked with premature babies and babies that are just any babies, but there's a lot that they are communicating and telling us about their body language, or through their body language, that we can kind of use feeding and when they're sleeping, different things, but um to help you understand, like, okay, how do I interpret these cries or cues or
yeah,
body language or tiredness, fullness cues that can help you have the newborn phase just go smoother and know when to intervene, because it's so confusing for moms. Like, so many people will be
yeah,
like, you know, because for example, in the early days, if they're too sleepy, that's actually not so good. That means maybe they're not getting enough milk. But then
yeah,
in the later days, if they're like alert all the time and having trouble winding down to go to sleep, maybe they're hungry. So it's like, oh my
right.
gosh, the same cues are like
How do you
flipping.
know?
So I think
Yeah,
I feel for parents that don't have this village and don't have this prior knowledge, and like the first baby they've ever held is maybe their baby, and that's
yeah,
the experience for a lot of people. And so then it gets confusing when you're like, you just need support and need help interpreting what's going on with your feeding journey so that you can like intervene in the right way and figure out what's going to be best.
yeah. What is
Yeah,
it, that phrase, "An ounce of prevention is worth like a cup of cure," or a cup of
literally.
intervention,
Yes.
or you know?
Yes.
And I think that's what we
Preventative
wanna
medicine.
accomplish, in our conversations,
Yes.
is this idea that, like, knowledge is power,
Yeah.
especially as a mother, and for providing for your baby. And
Mhm.
things like knowing that you need to, like, pump immediately, or like if your baby's not latching, or put your baby on your breast as soon as possible, as much as possible, on demand for the first 5 days, like that's actually an active role. Even that itself is such, it's removing a barrier to so many women breastfeeding. How many women don't know that, me, myself, and then if I were to have a baby now, before knowing that, I'd be like, "Well, my milk's not coming in, so I'm gonna
Yeah.
bottle feed," and then, I
Right.
can't provide my baby with as many benefits as I could if I breastfed.
Yes.
So,
If I
yeah,
just knew what to do. And then I always say, like, let's get the milk in.
yeah,
And then we can always decide. Like, you can always decide breastfeeding should continue as long as it's working for both mom and baby, right? So,
yes,
like, and the AAP even says that for the first 2 years, as long as it's working for mom and baby. So, like, if if after the 2 weeks or after, a couple months, you're like, hey, I need to make a change, that's fine. But let's at least get the full milk supply in so
yeah,
that
and then you
then
can choose.
the reason you're not breastfeeding isn't because of low milk supply. Because um, we also know the one main reason that people lose confidence in breastfeeding and like wean early is because they're doubting their own milk production. They're like
Wow.
scared that they don't have enough milk. But if you I mean, of course, there's always different medical things, hormonal things going on that we can rule out and make sure. But if you delivered vaginally the placenta and got your baby on the breast in the first 2 days and like many times a day, whenever the baby was alert, and then, you know, and we can talk about what that really, really looks like. Like, it's not
Yeah.
like the baby comes out and you have to put it right on. Like, no,
Yeah,
you can
but
of
it's
course there's nuance to all these conversations.
yeah,
But um if and it doesn't mean that they're going to be like drinking these huge volumes of milk. They just have colostrum at first, they're latching on, and you're both learning. Like, it's okay. There's some time that we can learn. Like, their stomachs are tiny in the beginning. So it's okay that
Yeah.
that like if it takes some time to learn, but we're just that's why we're looking for wet diapers, and we're kind of like seeing how feeding is going. We're like hearing if we hear some sucks and swallows, if the baby's calm and staying relaxed on there. There's different cues we can look for. But if I think, yeah, if you just kind of know what normal looks like, then you can have the confidence to be like, okay, my milk is coming in,
So
we're learning this, we're figuring this out. If a doctor prematurely asks you to supplement because they're worried about weight, and we can talk about that.
yeah.
But like if someone's telling you to supplement when there's not really an indication yet, then you'll have the confidence to be like, no, I'm going to wait because I don't want to mess up this on demand loop. Like, I want to keep telling my
Awesome.
baby to eat, and I don't want to have to introduce the pump yet if I don't have to.
Yeah.
Again, if the baby's not latching, you'll know, like, oh, I do need to pump to give my body this message because my baby's not doing a good job of it. And so
Yeah.
I'm going to protect my milk supply. Like, if you just kind of already have this knowledge, then I think we can figure out any problem later if
Yes, but
the
get
mom
your milk
has the milk.
supply in.
But, like, if the mom doesn't have the milk, then it's like, okay, well, now we have to figure out now we have another problem, right?
Yeah.
Um,
I feel like I have so many questions and I'd love to ask you so many more. What, like, yes, but
yes,
we do need to wrap up.
to close,
So,
yeah,
and I think it's really awesome just like moving forward, being like this idea. Someone told me this concept of like good, better, best. It was actually a nutritionist, and she was telling
nice.
me like
Yeah,
all of my products are toxic and like everything. But she was like, Catherine, don't throw them out. You know what I mean? Like
yeah,
it's good, better, best. Like it is good to have a baby. You know what I mean?
yes,
Like,
it's like not being all or nothing. It's like any therapist will
yes,
tell you, you don't need to be all or nothing about it. Yeah,
yes, yeah.
yes,
And it's better to breastfeed and it's best to, like just all of these things and giving women this information so that they can make informed decisions and
yes.
then go with their intuition as issues come up. So,
Yes. And then, like you said, like connecting it to like, what do we all want? We want a baby that, and like a toddler that is like well attached to us, that can
yes.
eat a variety of different foods, that can communicate well,
Yes.
that can sleep well, that can go to other caregivers if needed. Like, you know what I mean? Like,
Yeah.
we all want our kid to be thriving and successful in all these areas of development.
Yeah.
So, if feeding is the start of all of that,
Yes.
um, based on the relationship and based on the actual stuff that they're ingesting, like how do we just good, better, best, like and it's not to say that like you know yeah, just we don't need to be all or nothing. We need to just give people the information so that they can start somewhere. And then if you're in charge, I tell every mom I work with, like, you're going to get all this input from all these different people. You're in charge of your baby. You're the only one that knows
Yes.
every feeding and everything that your family is going through. Like, if you're like, hey, I need to be able to bottle feed this baby because I want my partner to be able to bond the same way I am, and I need to level the playing field a little bit. That's one thing. Or if you're like, no, I want to breastfeed at first because I'm off work for these 3 months and I really want that. But then I do need some flexibility when I go back to
Yeah.
work. Or
Yeah.
if you're like, oh, actually, for my mental health, like things have changed. I really did want to breastfeed, but now I feel like it's actually a disservice to my whole family if I'm not able to.
Yeah.
So maybe I need to breastfeed some, but like also pump some or also
Right.
supplement some. Like there's so many different ways to do this. And like you said, there's it doesn't need to be all or nothing. And
Yeah.
we just need to help give moms and dads information so that they can get the outcomes they want with feeding and with like introducing solids and helping their baby develop
Life.
into a great human. Yeah. So
Yes. Yeah. It's like choose your own
oh my
adventure, but keep it informed. You know what I
but be
mean?
informed with, yeah, and you never want someone to get to like, this happens all the time. Like they get to like near a year and they're like, and this is a small thing, like we can obviously correct this as an SLP. We deal with this all the time, but they get to a year and they're like, oh my gosh, my baby like is still only drinking milk out of a formula out of a bottle, and like, or even 2 years and like still on a bottle, and like now their teeth are affected, and like they don't want to drink out of a sippy, or they can't drink out of a straw cup. They aren't eating solid foods properly.
And they
Like
don't
they're
listen to
they're
me,
not listening
mom.
to me.
Yeah.
Yeah. they're not listening to me. Now I'm having behavior things. They're not communicating well because, and now they're saying for everything. Like,
Right.
you know, and it's not that we control all of that. Kids have different things, nature and nurture. Like they have things that they, that affect them. However, because of what you touched on the brain development, like their environment does really matter, and we shape a lot of their environment. So like if you're informed more, you can try to shape it in a way that's going to help them develop the best they possibly
Right.
can.
Oh, wow.
Great
Yes,
full
I,
circle moment.
I think that is the best way to end today's episode. I'm so looking forward to peppering you with more questions.
Me too.
And
I'm so excited for your perspective, and like I love that we get to nerd out about this stuff together. It's so fun to
yes,
talk about.
absolutely. Well, thank you so much, Abby. And yeah, we'll see you next time.
Okay, thank you, Catherine.